Constipation associated with a lipoma. Lipomas of the digestive tract are rare and most often found incidentally during a colonoscopy, computed tomography, CT scan, surgery, or autopsy. Lipomas of the colon were first reported by Bauer in 1757 and are most often located in the ascending colon near the cecum. These fatty tumors are rarely greater than 2 centimeters in size and are rarely symptomatic. The most common presentations of symptomatic patients with lipomas greater than 2 centimeters in size include abdominal pain, hemorrhage, diarrhea, or constipation. Lipomas that grow more than 4 centimeters in size can lead to obstruction and into suscepation, requiring surgical or endoscopic resection.
Lipomas are a really common benign clonal collections of fat cells. These cells are also called adipose cells. One fat cell decided to have a little party, kind of divide upon itself and kind of create its own little clonal population. And that's why they're all kind of contained in their own little sac or their own little area. They really don't have any change in the texture or the change in the skin surface at all. But underneath you'll feel kind of a rubbery mass or bump that.
Applications in medicine. These benign tumors are often difficult to diagnose because of their asymptomatic nature or the intermittent nature of patient symptoms. On plain radiograph, these lesions may produce a radiolucent area above the region of affected bowel. Barium studies are non-diagnostic unless changes in the lipoma's shape and size are seen via a diagnostic test. More commonly, definite diagnosis is made after the lipoma is removed and subjected to histopathologic staining. Surgical resection is recommended to alleviate symptoms and to rule out malignancy. In this case report, we describe an intussuscipated transverse colonic lipoma that caused intermittent bowel obstruction.
Hi, today I'm talking with Dr. Tom from NaturalNet. Our topic today is constipation. Dr. Tom, what exactly is constipation, and are there any negative health problems associated with being constipated?
Constipation is certainly not a topic that a lot of people will talk about, and as a physician, of course, we hear it on an ongoing basis, and theoretically, there's a whole bunch of different definitions of what constipation means, and it means different things to different people. I've had patients say they're constipated if they're having 3 bowel movements a day because the quality of the stool, as far as they're concerned, is not complete and doesn't feel right. And then there's other people who will only have a bowel movement maybe once or twice a week, and they'll say, "Oh, I'm not constipated at all," and because my doctor told me that that's what's totally normal.
Right.
So, in our society, there's this wide definition of what it actually means. So by theoretically, what's supposed to happen if our physiology, our organ systems, our digestive system, our endocrine system, our immune system, etc., are working properly, is that after every significant amount of food, after each major meal, perhaps 2 or even 3 times a day, there's a natural peristaltic movement that moves the food that has been in your digestive system down lower. And then there's a reflex that goes back up to the nervous system that basically says there's more food coming. We need to basically evacuate the bowel to be able to, take the next meal that's coming. So theoretically, there should be that type of a movement. So it's normal to have 2 or 3 bowel movements, as I said, after each a meal. And if that doesn't happen, then by definition, I would consider that constipation. There's a number of different types of things that obviously needs to be looked at. Fiber is the most common type thing. Being adequately hydrated is extremely important. But most people who have constipation, and it's a problem, and it definitely does create problems other than the local irritation and bloating feeling that people will get, because a lot of the toxins that are in the waste matter that need to be released unfortunately get reabsorbed into the system, and they can create things like brain fog and a little sort of a dullness, and energy can be a little bit lower. So it is definitely a medical concern and needs to be looked at, because we need to be eliminating our waste on a very regular basis, because otherwise they just end up being stored in the body. So we need to look beyond hydration, we need to look beyond fiber, because very often, and especially in problematic constipation, there's a whole other number of factors that need to be looked at, and that's typically what we do.
That's good.
Diagnosis. The diagnosis of a colonic lipoma can be established radiographically, endoscopically, or surgically. The pathognomic sign of a colonic lipoma is the squeeze sign, in which a radiolucent spherical filling defect with well-defined margins can be shown to change size and shape in response to peristalsis during administration of a barium enema. 90% of colonic lipomas are localized to the submucosa. Colonic lipomas are rarely found in other layers of the bowel wall.
Hi, I'm Susan, a nurse at Mayo Clinic, Arizona. Along with my colleague, a registered dietitian, and in collaboration with our gastroenterologist, we've developed a video series on constipation. The video series is going to include common causes and symptoms of constipation, the colon's role in constipation, lifestyle and behavior modification, and helpful hints. Constipation is a common gastrointestinal problem. It means different things to different people. For most people, constipation means difficult passage of stool or infrequent bowel movements. Typically, this is 3 or few bowel movements a week. There are many symptoms of constipation. These include excessive straining, difficulty expelling stool, hard and lumpy stools, a sensation of incomplete evacuation, which means you've had a bowel movement. After the bowel movement, it still feels as though you have stool within your rectal vault. Abdominal bloating, fullness, discomfort, or pain are also symptoms of constipation. A prolonged time to stool. We really encourage our patients to stool no more than 10 minutes. Last is the need to use manual maneuvers such as finger evacuation or lower abdominal massage. Here's an illustration of someone who looks like they're straining excessively, and I'm guessing they've been on the toilet more than 10 minutes. My suggestion to them would be get up, get on with your day, return to the bathroom when you get another urge. This is the Bristol Stool Form scale that we use. Our patients use this to help identify the type of stool that they're using. Type 1, Type 2 are hard, lumpy stools. This is associated with constipation. Type 3, Type 4 are normal stool consistency. Type 5, 6, and 7 are associated with looser diarrhea stools. Common causes of constipation: inadequate fluid intake or dehydration, inadequate amounts of fiber in your diet, ignoring that urge to have a bowel movement or delaying it till later, lack of physical activity, changes in lifestyle or routine, frequent use or misuse of laxatives, poor posture when seated on the toilet, stress, and the reduced ability to feel the urge. There are 3 primary types of constipation. During this video series, we're going to focus on functional constipation, which is more of your IBS or irritable bowel syndrome, and chronic idiopathic constipation.
Conclusion. In summary, large symptomatic colonic lipomas should be excised either surgically or endoscopically. Small lipomas with pedunculated bases in patients with normal blood counts and tumor markers may be amenable to endoscopic resection. Lesions that are greater than 4 centimeters in size and/or lesions found in patients in whom malignancy cannot be reasonably ruled out should undergo segmental resection.
How to relieve constipation naturally. When you gotta go, you gotta go. But what if you can't? Unburden yourself with these tried and true natural remedies which really get things moving. You will need acupressure moves, yoga poses, rhubarb, flaxseed, and preventive measures. Optional, a footstool. Step 1. Try this acupressure trick. Hold your hands up, palms toward you, and tap the sides of your hands against each other. Then cross your arms in front of you like a genie, so that your palms rest on your elbows and tap that area. Alternate tapping the 2 points for 5 to 10 minutes. This helps induce a bowel movement by stimulating your colon. Step 2. Try yoga. The shoulder stand pose and wind relieving pose both move the stomach and intestines in directions that can help food pass through the body. Find video instructions on howcast.com. Step 3. Eat rhubarb, which contains anthraquinone, a compound that has a laxative effect. Step 4. Avoid foods that can constipate you further, like sugar and sweets, white bread, white rice, cheese, and hard-boiled eggs. Step 5. Take 1 tablespoon of ground flaxseed 2 or 3 times a day with at least 8 ounces of water. Step 6. When the urge hits and you're on the toilet, help move things along by lifting your legs off the floor so that your knees are higher than your bottom. This stimulates a squat, the ideal position for moving your bowels. Putting your feet on a stool makes this more comfortable. Step 7. Prevent future bouts by drinking more water, eating more fiber-rich foods, and getting enough exercise. Too little of any of these can cause constipation. Did you know? Famous Greek physician Hippocrates believed that eating garlic every day prevented constipation.
Thank you for listening.